everyone, this is Island Nurse and welcome back to my YouTube channel. Now in this video, we're going to be going over another NCLEX type priority question. And in a previous video, I went over some strategies that can be used when answering priority questions. And in case you haven't seen that video, I've left a link in the description box below. So let's begin. A patient receiving a unit of packed red blood cells suddenly complains of nausea, dizziness, and lower back pain. The nurse also observes blood in the urine, and the patient's temperature is now 100.5 degrees Fahrenheit from a baseline of 98.6 degrees Fahrenheit. What would be the nurse's initial response? And we know that this question is a priority question because we see this term initial response. So I've gone ahead and highlighted the major points here, the major portions of this question. So we know the patient is receiving red blood cells, and that is going to be very important to us determining the answer to this question. And we also have a list of symptoms that the patient is complaining about. The patient is nauseated, the patient is feeling dizzy, he or she is having lower back pain. So these are subjective symptoms. So this is what the patient is complaining about. But we also have some objective data also. So the nurse observes blood in the urine, that's objective, and we see a change in the temperature. So the patient started out with a temperature of 98.6 degrees Fahrenheit, and the temperature has now gone up to 100.5 degrees Fahrenheit. So NCLEX wants to know, based on all of this, what are you going to do firstly? What is going to be your first response as the nurse? Now, there are some things that jump out at me right away in this question. So the fact that the patient is receiving red blood cells, for instance, and not plasma, that jumps out at me because I see the lower back pain. And I know that patients who are receiving red blood cells are at risk for developing hemolytic reactions, hemolytic transfusion reactions, and I know that one of the cardinal signs of a hemolytic reaction is lower back pain. So that is something that I know up front. So even if I were uncertain about some of the other signs and symptoms here, that is something I know up front. So let's talk about a hemolytic reaction. So a hemolytic reaction basically occurs if there is a problem with the cross and type match, meaning that essentially the patient has received the wrong blood. So what happens is that the antibodies in the recipient's blood, and the recipient here would be the patient, begins to destroy the antigens in the donor's blood. When this happens, the red blood cells basically break apart and hemoglobin is spilled out into the blood. The excess hemoglobin being built up in the blood causes symptoms such as nausea. It also causes dizziness, and it causes blood in the urine. And I also know that when hemolysis occurs, this tends to release harmful chemicals into the bloodstream, and these chemicals damage the kidneys, hence the reason for the lower back pain, and the harmful chemicals also cause an increase in the temperature. So now the patient's signs and symptoms make sense, and so I have determined, based on all of the information in the question, that this patient is having a hemolytic reaction. And so the question is asking, what should the nurse do first? So let's read all of the options and then we'll go over each individually. Option A, obtain vital signs on the patient. Option B says, administer PRN acetaminophen 500 milligrams as ordered. Next, stop the transfusion and infuse normal saline. And D, call the physician and update him or her on the patient's status. Now, one of the things that you would observe with priority questions is that all of the options could be correct. So when you look through the options, you may be saying all of these are actions that the nurse should take. They're all correct, but we're trying to determine what should be the first thing that the nurse should do. So let's go ahead and examine each one individually. So the first one says, obtain vital signs on the patient. Is this something that a nurse wants to do? Definitely. If the patient's condition has deteriorated, you definitely want to obtain vital signs. But would you do this first? Would that be your initial reaction if the patient is experiencing these symptoms? If the patient is having a hemolytic reaction, would that be the first thing that you do? I don't think so. So definitely I would put a check here and say this is not the very first thing that I would want to do. Let's look at option B. Administer PRN acetaminophen 500 milligrams as ordered. Now you may be tempted to say, okay, this patient has an increase in temperature, and we know that acetaminophen is an antipyretic, and this is sometimes given after blood transfusions. When a patient has febrile reactions, it's sometimes given to control the fever. However, if the patient is having an acute problem, would your first reaction be to administer medication? I don't think so. Let's go on again. Stop the transfusion and infuse normal saline. So the patient is having a hemolytic reaction. The patient is having an acute reaction to a blood transfusion, right? The patient is in some type of distress at the moment, and you see the patient's vital signs begin to deteriorate. So definitely you would want to stop the blood transfusion because you want to prevent further harm from coming to the patient. You don't want the patient to keep receiving the blood that is causing them the problem in the first place. So yes, you would want to stop the blood transfusion. But how about the second part? It says infuse with normal saline. Now, you know that one of the rules of blood transfusion is that normal saline is the only other fluid that you can infuse while a patient is having blood transfusion. So definitely you want to infuse normal saline to keep the vein open. And of course, when you do this, you want to use a different tubing. You don't want to use the same tubing that you have used with the blood transfusion. So I would say that this sounds like the correct option, but we have to read down. We have to go down and read all of the options. So D says, call the physician and update him or her on the patient's status. Now, if the patient is experiencing a hemolytic reaction, does the physician need to know? Of course. However, is this the first thing that you're going to do? Even before calling the physician, you have to obtain some vital signs on the patient. You have to have some assessment data to give to the physician. So while it is true that the physician needs to know, this would not be the first thing that you would do. And so the answer here for this question would be C. If the patient is experiencing a hemolytic reaction, as the nurse, the first thing you want to do is to stop the transfusion because you want to prevent the patient from receiving more blood. Remember, the blood transfusion is what is causing the patient's problem in the first place, and you want to infuse with normal saline to keep the vein open. And just by way of information, on NCLEX questions, when you see this option that says call the physician, it's very rarely the correct answer. Now, in some instances it is, but in my experience, in the majority of cases, it's typically not the correct answer because NCLEX wants to know what you as the nurse are going to do. What actions are you going to take as the nurse to protect your patient or to prevent your patient from getting harmed any further. And calling the physician does not say precisely what you as the nurse are going to do, what intervention you are going to take. So there you have it. We have gone over another NCLEX priority question, and if you found this video informative, don't forget to hit that like button and consider subscribing to my channel if you haven't done so already. Thanks for watching and see you next time.